bringing you only the best in dental products. Clicks. Feel good. Pay less.
Now, last year, the FDI, and that is the World Dental Federation, launched their 3-year campaign, which is themed Be Proud of Your Mouth. And Be Proud of Your Mouth is not about having a perfect mouth. It is also about having a healthy one. Now, the World Dental Federation would like people to value and take care of their oral health and to make the correct decisions in order to protect oral cavity. The good oral status will require a lot of action. So firstly, be proud of your mouth by doing this. For example, be proud of your mouth by visiting the dentist regularly. Be proud of your mouth by brushing your teeth twice a day. Be proud of your mouth by cutting down on sugary treats. And to inspire action, we need to explain why, and this is where the campaign a strapline fits in. In 2021, the World Dental Federation encouraged the public to take action by focusing on the importance of oral health in order to enhance overall health. Now that we find ourselves in 2022, they are reiterating this message by highlighting the fact that an unhealthy mouth can severely impact every aspect of life, and that is why they're calling upon everybody to look after their oral health for their happiness and well-being. Today's oral health interview is proudly brought to you by the South African Dental Association, known as SADA. And SADA's vision is to be recognized as the trusted leader and voice of oral healthcare in Southern Africa. Their mission is to promote the interest and serve the needs of their members, and above all, encourage optimal oral healthcare for all South Africans. And you can learn more about the South African Dental Association by visiting sada.co.za. So joining me today to talk oral hygiene and working with the geriatric patients is Miss Christine de Souza. Now, Christine is a qualified oral hygienist and with a special interest in the connection between oral health and periodontal disease on broader health issues, that is. And a love for oral was sparked for oral health was sparked while she worked as a dental assistant in Dubai in the UAE, after which she formally qualified at Wits University. Now, Christine's unique approach to oral health has seen her featured on TV, and she's regularly invited to speak onto this topic at dental conferences. This is why I am actually talking to her as well. And currently, Christine invests her time in focusing on oral health in the elderly, and through her work with the aged, she has made remarkable impact on the health of her patients, such as reduced urinary tract infections, lowering the dependency on antibiotic treatments as well. So without much further ado, Christine de Souza, thank you so much for joining us on Clicks Live. How are you?
Very well, and you, Google. Thank you for having me.
Absolute pleasure to talk to you, because we know you're very busy when it comes to this. And today we're going to be talking about oral hygiene and working with geriatric patients. Now, let me put this out to you there, just straight off the bat. If you're older, I can't get cavities, right?
Wrong. They're not just for children or kids. In fact, cavities happen more often in adults. And the reason for that is the elderly have older fillings, which are prime spots for like decay, where it gets rough. And as we get older, our gums tend to recede the way we brush, in a horizontal swoop, leaving the tooth roots exposed. And without the protection of the tooth enamel, they can become more susceptible to decay, which is holes.
Okay.
And then also in the elderly, they might suffer from dry mouth. And this can be a side effect of the medication they're on or the condition of their saliva. And you see, saliva does more than keep your mouth wet. It also protects your teeth from holes and decay and helps heal sores in your mouth and prevents infections.
Yeah.
So anybody can get holes around fillings or on your teeth. It doesn't really matter whether you're young or old, because plaque is 3 things. The plaque is the bacteria in your mouth, the food you eat, and your spit. So what happens under a microscope, if you want to put it that way, the bacteria eat the food, they drink your spit. What comes out of the bacteria's body is the plaque, and that is an acid. And that's why we've got to brush till the day we die, because we can never stop eating. We can't get rid of our bacteria, and we can't get rid of our spit. So we will always be susceptible to that. So it's important to have it checked out.
Yeah, and this is why I'm asking you this, because it might be a misconception the older you get that you are sort of immune to cavities, but this is not the case. This is something from as soon as the first teeth start forming all the way up until you have absolutely no more use for the teeth, I would imagine. So this is something we got to do, which leads me into the next question I want to ask you. Now, assume my mouth is in pretty good shape, right? Yes. But my teeth are now super sensitive, and this is whether I'm eating or drinking something that is quite cold or hot, and what is going on? And this might occur, I would imagine, the older you get, that you have more prone sensitivity.
Yeah, Googles, you see, this can happen to anyone at any age. Your gum tissue pulls back from your teeth, uncovering some of that root. We call it dentine. And this can make the area very sensitive to temperature extremes. So as a quick fix, we use fluoride mouth rinses, or we switch to a toothpaste made for sensitive teeth. If your problem is more serious and the problem lingers longer, then a visit to the dentist or oral hygienist may seal that area and bond the roots to close them up, so there's no communication with the nerves, so therefore you won't have the sensitivity to the hot, cold, and sweet things. And they might recommend a soft tissue graft also, and to cover that exposed dentine with a material, either man-made or from another area of your mouth, to cover those exposed roots.
Okay. And this is irrelevant, because you kind of have the same sensitivity feel, whether it's hot or cold or sweet.
No, some people can have it to very severe sensitivity, and then of course that is that exposure. Or on top of the teeth, they could be grinding their teeth or clenching their teeth, and the top of the teeth wears down, and that could lead to sensitivity also on the top of the teeth, because they wear those teeth down. So it's not only just the way you brush. It could also be inflammation that's around the tooth that could be causing the sensitivity as well, as the gum gets red and swollen and tender to touch. Or there could be bleeding on manipulation. Now, when you have something hot, cold, or sweet, all of those factors have to be looked at. So teeth shouldn't be sensitive. You shouldn't be having sensitive teeth, because there is an underlying problem that needs to be checked out.
You mentioned something there, grinding of teeth. Now, I don't know, everybody that is maybe a little bit more on the better side of years than what I have, they seem to do that a lot. I've noticed, and it is something you that is a bit more prevalent today. What is a quick fix? Because I've heard of people saying that they would purchase a mouth guard, especially when they go to bed.
Absolutely, and you see, the thing is, in the last 2 years in my practice, I have never seen, in over 25 years of dentistry, grinding as I've seen now during COVID. And the reason for that is because people are stressed, and at night your only way of releasing the adrenaline that gets exposed is to clench or grind your teeth. And that then leads to the sensitivity. So your thing to deal with it is to have it checked out, and a dentist can do an impression of your mouth, an upper or lower, whichever jaw part they feel that there's more grinding, and then they send it to a lab and they make you a custom-made bite plate that will fit snugly around your teeth, and you can grind that instead of your teeth. They've even measured, there was a research that was done where they measured 50 kilograms of clenching from the top tooth to the bottom teeth. So if you can look at a tooth, the shape of the tooth makes like an arch. Yeah. And when you grind it down, 50 kilograms, like a diamond can cut a diamond, enamel can cut enamel, those teeth become flat like Table Mountain. And that then leads to the sensitivity. So you would rather take an acrylic bite plate and grind that than your teeth.
Yeah, no, and that is why I'm asking you this, because I don't know, a lot of people seem to be doing it, which obviously, as you now highlighted, could lead to a little bit more sensitivity as well. And that might also occur in certain individuals where they might go, listen, my teeth sometimes feel a little looser, especially the older you can get. So what do you do now?
Yes, so therefore will need a bite plate and have an assessment with a dentist or a hygienist. And this can happen for many reasons why the teeth feel loose. It could be the bite or the clenching. It may be a sign of bone loss from the gum disease, from the plaque that gets hard into calculus into the tissue. You may need to see a periodontist to have a look and deep clean that area, a doctor that specializes in mouth, gums, and bones, so the supporting structure of the tooth, and have an assessment with them. And then there could also be certain conditions like diabetes can also affect your gums and teeth. So it is important when your teeth start feeling loose is to go and have an assessment, either with a hygienist that will refer you on to a dentist or a periodontist if it's very advanced.
Yeah.
Because what happens is when those teeth start getting loose, it can only progress worse. So you want to rather save your teeth than lose your teeth.
Yeah.
Because nothing can be better than your own teeth.
Yeah, and like you said, this is of course getting into and having that call of action quite early.
Exactly. Prevention is better than cure.
Yeah. That's what you always hear.
Always.
Let me ask you this. It's a bit of a naughty question because some people smoke, right? And I remember years ago actually hearing something for every 10 years that you might have smoked, and this is what I vaguely remember, and might cause you to lose more than 1 to 2 teeth, you might lose in, let's say, a decade, in about the space of 10 years. Is this true? And if you've been smoking for a long time, what does it mean in general for oral health? And I would assume, you might have a bit of a discoloration up front.
Yes. Well, the thing is, what I found in my practice, when patients smoke, not only are you likely to have a bad breath and stained teeth for starters, but what happens is that plaque can get hard, and then the bacteria eat the supporting structure underneath it. And most of my patients don't see blood when they floss or brush because it's almost like the capillaries get frozen from the nicotine. So you don't really know that there's an underlying problem that's happening under the gums, you see. So it's very important, again, to go and have a proper clean when you do that. And it also might take longer to recover, like somebody that smokes from a pulled tooth.
Yeah.
And they could be at risk of periodontal disease. But the harsh reality of long-term smoking is that it raises the chances of oral cancer.
Yeah.
And so does your age.
Yeah.
So if you find a wound or sore area in your mouth, especially like what we call a leukoplakia or erythroplakia, these are red growths or white growths, or anywhere in your mouth, under your tongue, on your lip, in your gums, it must be examined to keep a close eye on it by a professional.
And just to touch on what you've said, because I've actually had this conversation, and just amongst friends and family, and everybody seems to be of the opinion if you use a whitening toothpaste, you kind of get rid of whatever stains would have been caused by excessive smoking, or let's say coffee, or anything that would stain, for that matter. Yes. But touching, I get the sense of what you're saying. This is not really the case.
Well, no, not really. So it can slightly lighten what we call the pellicle layer, where the first layer of plaque develops. But once calculus, which is plaque that's gotten hard, it takes about 3 or 4 days to get hard.
Yeah.
We call it calculus, another name is tartar. The stain of the cigarette or any food pigmentation can actually penetrate into that hard plaque of calculus or tartar, and that you cannot remove with a whitening toothpaste. The only people that can remove that is a dentist or a dental hygienist with a good scale and polish, you see.
Yeah.
So whitening toothpaste, no, it can't really remove the stains completely unless it's just on the layer of the tooth.
Okay, so there we have it. It makes a lot of sense with me. So if you've just joined us in store, thank you very much for joining us at Clicks. We are online talking via telephone based in Johannesburg. Christine Souza, who is a qualified oral hygienist with a special interest in the connection between oral health and the periodontal disease, and as well as on broader health issues. And the reason we're having a conversation with her is because on the 20th of this month, it is the World Oral Health Day. And, of course, they're just creating a lot of awareness around this. Now, let me ask you this, Christine. This is a question I want to ask you. Let's assume I have a friend and I want to take somebody to get dental treatment. But this individual have dementia. What should I do?
Okay, well, the most important thing is to make the appointment for the patient early in the day.
Yeah.
Like let's say when your friend is most alert. Also make sure to tell them where they are going and why they are going, and let the dentist or the hygienist know ahead of time about your friend's condition. Very important so that we can prepare.
Okay.
Communication will make the visit much easier. If possible, have one of your family's friends, members go with them to the appointment, and they can make the treatment decisions if they can't, do you see, with dementia or Alzheimer's patients.
Yeah.
It's best for someone with dementia to see a dentist as soon as possible. After they've been diagnosed, it will be difficult because if any procedures are needed, they should get them done as soon as possible. That way, as the disease gets worse, unfortunately, your friend should only need easier maintenance treatment down the line. And I see that at the retirement homes.
Yeah.
So before they go in, they'll come to me, and then it's easy. Then the children just phone me and say, please go see my dad or my mom. And I do that regularly every 6 months, and it's purely maintenance.
Yeah.
So most of the bigger. And then obviously educating the caregivers in the retirement homes or the frail care facilities on how to maintain the oral hygiene.
Yeah.
So that's been one of my main missions where I go, is the caregivers are educated why you've got to brush, why do you have to floss, what are the easiest treatments for a patient with dementia or Alzheimer's, when it's progressed into Alzheimer's.
And that is the reason I'm asking you, because I know that you spend a lot of time working with patients in care homes and the elderly, and I just thought, that would definitely be something that happens. The other thing I wanted to ask you, because most people I know who are also, let's say, a little bit more on in years, most of them would probably go, well, why do I have to see Christine? Why do I have to see an oral hygienist? Because I don't have teeth. I have dentures.
No, I do know that. The thing is it's a good idea to visit a dentist or an oral hygienist at least once a year for a full oral examination.
Okay.
Because as you age, you might have issues, but they might not know it, you see. Dentures are made to fit perfectly. So if you feel a looseness, it's likely they need to be adjusted to make them fit again properly. Yeah. To see your dentist as soon as possible for a temporary fix, or they can even use a denture adhesive to keep them stable until you see a dentist to adjust it or reline it.
All right.
So don't try to change. And I've seen patients, they take, drills that they file the nails with, and they try and change the shape of their dentures themselves.
Yeah.
And even if you think you can make them fit better, you could end up damaging them.
Yeah.
And have to make a whole new set again. So it is important. Yeah. And also with the elderly, they start losing a lot of weight depending on the medication they're on. And then the denture doesn't fit. And then how do they eat? So I've seen that so many times where we have to go in and take impressions and just reline. A simple reline can do the job.
Yeah.
And patients that are in frail care that do suffer from dementia and Alzheimer's, they can't communicate and tell you. The nurses see that the dentures drop. And then how do they eat? And then that has a domino effect on their whole general health.
Yeah.
So it is important to have a check to see that the denture fits properly for speaking and also for the communication and the eating.
Yeah, and I suppose a lot of people would be sitting with that. Like, it used to be comfortable, now it's a little bit loose. But like you say, have it checked out, and also, like an adhesive can work wonders there. Now, let me ask you this: you go into the retirement homes because you are mobile. What are the teeth problems that you see regularly? What are the sort of, okay, these are like, I'm definitely going to see this. These are the high-end problems. I deal a lot more with that. What would those be?
Oh, goodness. It's really, really dirty dentures, teeth that are not being brushed and flossed, the food's getting stuck, especially with patients that cannot communicate to you where a piece of food stuck on the top left-hand side, for example.
Yeah.
And I've pulled food out that's been there for days. They can't feel it. They've lost their tactile sensitivity to actually suck the food out between their teeth. The dry mouth also, because of the medication that leads to the cavities, etc., etc., we've got to treat the dry mouth. Broken teeth. Recently, I just saw now, which we were shocked at, the patient had a denture that was never taken out, and the gum actually grew around that denture. We had to surgically remove the denture out and stitch up the tissue. And educate. And then a couple of years ago, one of the worst cases I saw is one patient was suffering from terrible sensitivity, again a communication problem. They couldn't explain they were sensitive. So at night, they started biting their fingers. And we eventually had to get boxing gloves and cover their fingers, and they were biting on the boxing gloves while the gums healed after I treated it. So it is important, and I can't stress it enough. If anybody here has parents at a retirement home and they know they're in a frail care, please let the dentist and hygienists go and have a look, because you don't know what's happening in their mouth. It really makes patients feel so much more comfortable when they've had a good clean and you've taken the sensitivity away. And if there's broken teeth in the mouth that you're not aware of, that affects the body. Like we also had another patient the other day, we had to remove the broken teeth. And now this patient's eating beautifully. The patient's whole demeanor, everything's gotten better. So it is important, to look after the elderly.
Yeah. Before we part ways, I want to ask you this, because, look, we know in terms of tips, like floss daily, use mouthwash, fluoride toothpaste, try and visit the dentist at least, or oral hygienist in your instance, at least twice a year. But when it comes to sugary substances, whether it's fluids or foods that we eat, we notoriously know that's bad. And I don't know if this is myth or fact, but when it comes to starchy substances, is there any truth in that as well? Absolutely.
Any food that's got a preservative in it, that's got a breakdown of sugar, any food, even fruit. Like I said, we will always have to brush our teeth till the day we die, because we always have to eat, we will always have saliva in our mouths, and we'll always have bacteria. That's why we brush. So no matter what the food is, we've still got to clean, and we've still got to floss or use interdental brushes that are specific for the sizes in that unique patient's mouth, which is shown by an oral hygienist or a dentist to make flossing easier if flossing can't be done. So you have to remove as much as that, because the mouth is the dirtiest part of the body. And especially now with patients that are wearing masks, you've got to clean even more now, because you're aspirating those oral bacteria into the lungs. So it's important to brush and floss daily.
That is super, super important. That is absolutely super important. Christina Souza, thank you so much for joining us. Thank you very much for coming on to Clicks Live and talking about a serious topic, and especially when it comes to oral hygiene. Now, of course, you've got your practice, you go here and there and everywhere. How would people get, and how can patients and our listeners listening out now, if they want to get hold of you, how can they do that?
Okay, so I've got a Facebook page. It's called Christine's Mobile Smiles.
Okay.
And I'm based in Fourways, Johannesburg, in my practice in Broadacres. I'm behind the Broadacres Spa, and I can give my cell phone number. Whoever wants to come and have an assessment is more than welcome to. My number is 082 312 8895.
3895.
082 312 8895.
Excellent, excellent. Or alternatively, you can find you on Facebook at Christine's Mobile Smiles.
Correct, Google's got it.
There we go. Christine, thank you so much for your time. Thank you very much for coming on air with us and discussing this very, very important topic as well. And I know it is going to be a big build-up, especially to the World Oral Health Day taking place on the 20th of March. So thank you once again for your time here with us on Clicks Live. Thank you.
Thank you, Googles. It was only a pleasure. Thank you for having me.
Big pleasure.
Have a good day.
Likewise.
Thank you, Googles.
Christine Souza, everybody. She is an oral hygienist, of course, and she specializes on oral hygiene and working with geriatric patients. And if you want to get in touch with her, of course, easy. So a way to do it is just find her on Christine's Mobile Smiles, which you can just find her on Facebook, of course, and get in touch with her. So the reason we spoke to her is because the theme from the World Dental Federation is be proud of your mouth, and you definitely got to take care of it. And don't forget that the 20th of March is World Oral Health Day, which is the 20th of March, which is just a couple of days away. Now, of course, here at Clicks, you are in luck and definitely in the best shape because we've got great offers for you, and especially when it comes to oral health products. And I want to look at that next.